ready for another episode and glow and grow with Lueur Health and Wellness. Today we have the Dr. Cotton of Chiropractic Medicine, and she is located in the DeSoto area, and we're going to have a frank discussion about health and wellness, obesity, your body, how you move. Let's get into it.
Ooh, let's do it.
So tell us about yourself, Dr. Cotton.
So I'm the owner of DeSoto Chiropractic Wellness Center, like she mentioned, also in the DeSoto area. I specialize in sports rehab, which simply means you don't have to be a weekend warrior or an athlete to seek care from me, but I prioritize the importance of active rehab coupled with chiropractic care is what we like to call the multimodal approach, where we couple chiropractic care, active rehab, in some form of passive modality, whether that be cupping, dry needling, taping, laser, ultrasound. We do it all because studies show that a multimodal approach to care is the best way to get a patient better as quick as possible.
Yeah.
So that's what we do. No shade to any other chiropractors. That's one thing I will say I love about the chiropractic profession is that the scope of practice kind of allows you to do your thing. Some doctors, they have no interest in rehab whatsoever, and they focus mainly on the chiropractic adjustment as the primary modality, and that's awesome. And they partner with other practitioners like physical therapists or athletic trainers to still get their patients that multimodal approach.
Right.
So
That's good. So one of the things I would like us to discuss is how does it work in regards to obesity and how it affects the body, your gait, pain, and
yeah.
how does chiropractic medicine help in that regards?
So as it relates to obesity, we tell our patients that your weight as it relates to your height,
Yeah.
how they come together, it has a bearing on your joint health. And so within the chiropractic scope of practice, you can make nutritional recommendations, but in the state of Texas, it has to be related to the musculoskeletal system. And so making dietary choice changes, and supplementation recommendations that relate directly to weight is in our scope of practice because it has a direct bearing on joint health. And so I also have a Master of Science in Functional Nutrition, and it's one of the things that I emphasize in my office. I offer nutrition consultations and recommendations for every single patient, whether your insurance really pays for it or not, because I'm just kind of that excited about how just making dietary changes can have a serious bearing on all like health conditions. That's one thing I learned in my program, that I mean, almost anything is changeable through just dietary changes. And so it depends on also the type of patient that you are. We have certain athletes and people who have life changes that their weight, for whatever reason, they've done everything that they can think of. And even the athletic population, some genetic factors play a role in the fact that those patients just don't lose weight easily, or they stay in a certain BMI no matter how hard they're working. And so it's really good to work with patients on how to manage that holistically. And if that doesn't work, how to partner with other practitioners to manage it with medication if necessary.
Yeah. I love that it's about the partnership, right? Because, I may be an expert, not may. I am.
And
I am an expert in family nurse practitioner, right? Or being a family nurse practitioner and being able to navigate those waters. But in terms of like the musculoskeletal system and the way that our joints are set up and alignment, that is out of my area of expertise. But how your body is positioned in the universe and how you interact also can play a heavy role on how you see yourself,
yeah,
right? Because if you're in out of alignment physically, I'm not surprised if you may be out of alignment emotionally or in your relationships or in your health, right? So it's a holistic approach in the set essence of making sure we have all the right key players to make the patient the happiest, healthiest version of themselves, right?
absolutely.
And so I think when we as providers kind of, I don't know if I want to call it gatekeeping, but we kind of like, oh, I can solve all things for my client and then that's it. You don't go to anybody else. I feel like it does a disservice to the client, especially when there's certain signs that they may benefit from a chiropractic adjustment or a nutrition
Absolutely.
consultation or whatnot. And so I want to go into the scope of practice in ordering lab work because I remember we talked about that a little bit, but I want
Yeah.
everybody to understand what you can do.
Yeah. So because chiropractic care or chiropractors in the United States are considered primary care providers, we are allowed to order lab work and diagnostic imaging if we have a patient that comes in the office and they're showing slow improvement, even
Yeah.
if the chiropractor is doing evidence-based care. And so also we do orthopedic exams. So
Right.
the purpose of that is because, say a patient comes in and they say, I have low back pain, right?
Right.
And you do all the orthopedic exams possible, but you can't reproduce that exact pain
Right.
that the patient has, then you have to start looking at systemic conditions or things that pain that may be referred from organs. So, like your
Yeah.
kidneys can cause low back pain, and for patients, they get confused by that.
Yes.
For them, it's just pain is pain, it's general. And so that's when you can step in and add that layer of your scope of practice and say, okay, we're going to send you for lab work to see maybe you have some labs that are off, and maybe this isn't related to the skeletal system at
Yeah.
all,
Yes.
especially if a patient has diagnostic imaging and they see absolutely nothing there, even with MRI, with the soft tissues, if they see absolutely nothing, then you have to start taking a look at the organs.
Yeah, I agree. And again, it goes back to that central theme that the body is made up of all these different things. And for us to expose that root cause, we do have to take a holistic approach to healthcare.
Absolutely.
So now in the community, there's crunchy and there's not so crunchy. I think as I am doing more family medicine and all this other stuff, I am transitioning into more crunchy than I was before.
Hmm.
So what crunchy means is like, supplements only, Ayurvedic type of medications and medicine type of treatments and herbal medications and stuff. And
Oh,
so
that's new terminology for
yeah,
me.
crunchy.
Okay.
Yeah, crunchy. So, I will say I no longer do a pill for every ill. I do feel like you mentioned, food is healing if used in the right capacity. If used in the right capacity, can decrease inflammation. Which is a number one issue, or I can't speak on your profession, but an issue in your profession when it comes to the pain that you're feeling and the adjustments that we need to make or whatnot. And so I think it's very important also to analyze that everything that we have is used as a tool.
Yeah.
It's not necessarily the say all be all in any certain particular category. And so, just a preface, always talk to your provider. Do not take any of our information without talking to your provider first. That's a disclaimer. We're not a substitute for any kind of medical advice. This is just our anecdotal and professional experiences. Okay, now that we got that out of the way, I should have said that first. But I get so passionate about this subject. So one of the things that we do a lot of, which is semaglutide, the tirzepatide, the Manjaros, and all that stuff. Like, what have you noticed in your personal professional practice with the utilization of those medications?
So I'd say a fourth of my patient load has been prescribed some
Wow.
form. And I would say, especially combining my degrees, there are certain patients that absolutely need it. They've tried the lifestyle changes, they've tried the increase in physical activity, and they see absolutely no change in their body composition. And it can be frustrating. And then that's when you start to have emotional and cognitive
Yeah.
um, ailments come into play because it plays a role on your psyche, especially with our generation and with our society right now is so social media driven. You've got people giving nutritional advice online, like this is the thing that's going to make you lose all this weight, and they've tried everything you can think of without results. I think it's important at that point to bring in medication and see how it can make a difference in the patient's life, because they've tried the holistic approach, especially for certain patients who carry a lot of their fat in their abdominal region where their vital organs are. It can be extremely dangerous to hold fat there for extended periods of time. And so I actually applaud those patients who have at least tried to make lifestyle changes, and and they don't see a difference. But you also have to understand, which is, it gets me so excited talking about it in the nutritional aspect. There's so much new research that comes out yearly, because we still don't understand 100% of how the human body itself works. And so they find new digestive enzymes, proteins in the gut yearly. And genetic factors play a serious role in weight loss, weight gain, uh, weight management, and how people carry their weight, whether it's in their hip and glute area, more so in their abdomen. That genetic factor can't be avoided. And so especially for people that they have the family history, and the weight just cannot be lost, with holistic approaches, it's absolutely necessary, and it shouldn't be avoided or frowned upon.
Yeah, because I still feel like, there's some judgment when clients choose to use a medication like that to help. But like you guys are probably heard now through the series, it is utilized as a tool.
Yeah.
It is not the say all be all. And it needs to be coupled with proper nutrition, dietary factors, exercise, chiropractic adjustments. It's just to make sure that you are in alignment, right? When you're in alignment, you feel better. It's easier to lose the weight. Metabolically, you're not as brain fog. There's all kinds of things that happen when you're in alignment. And so anything can throw you out of alignment. And it could be as simple as a blood sugar that's elevated, or your cholesterol being elevated. But those are things we won't know unless we get the data to verify what's really going on with you. So although social media has been great in getting the medication, the notoriety, I feel like there's also some false things that have been said about the medication. Like sometimes we'll have clients that come in with unrealistic expectations. They think that taking the medication is like this magic bullet. They go to sleep and they wake up 25 pounds lighter. And that's not the case.
Yeah, and you don't want it to be the case,
That
because
part.
that it's not sustainable.
It's not sustainable.
I talk to my patients about that as well, that studies show that losing 1 to 2 pounds of weight per week is what's healthy and what's sustainable. Now, with using a medication like that, you may have it accelerated a bit, but if you're losing between 2 to 3 pounds in a week, that's a good goal. That's a good goal to have.
Yeah.
And I also, for those patients, I like to make sure that they are in contact with someone who, it does, maybe it's just a counselor, some form of stress management.
Yes.
That could be mindful meditation for some, yoga for some people who know that they aren't going to incorporate that in their day-to-day routine. It could be meeting with a counselor once a week or once every other week. But stress factors also play a role in weight loss, weight management. And so if you're constantly fixated on that, it can become unhealthy.
Yes.
Absolutely.
I think too, what we noticed as we started progressing and growing as a clinic, a lot of clients do suffer from the emotional aspect of food. And then it's also cultural based,
Yeah.
right? Food culturally, especially in our community, has a very heavy bearing, pun not intended. But it can be very hard for clients to, oh, we got a patient. But it could be very difficult for clients to go ahead and get things done. And I think we have to notice that mental health in our community is huge. So I like to reference Mark chapter 4 with my clients, right? And I think specifically in communities of color, it's, oh, well, you didn't pray long enough, or you didn't tithe big enough, or something that you did that qualified you for feeling the way that you feel. And in Mark chapter 4, the man was riddled with demons, right? And he was living in the cemetery and he was chained up, and the people in the community were very scared of him. And Jesus went out with his disciples and they were looking for him, but they already knew what his name was. When they stumbled across him in the cemetery, the disciples were scared, but Jesus was like, "What is your name?"
Yeah.
But we know through the scripture, he wasn't talking to the man because he already knew what that man's name was. He was talking to those demons.
Yeah.
And then when the demon said, "My name is Legion, for I am many," he goes, "Okay, Legion, get out of this man and jump in and get in those pigs and then get off this cliff." Right? So all the pigs jumped off the cliff. And so I say all of that to say, you cannot change what we don't name.
Yeah.
And I so often see it in our communities. Oh, are you feeling anxious? No, I ain't gonna claim it. I ain't gonna claim it. Are
Right.
you depressed? I ain't gonna claim depression. I ain't gonna claim depression. Do you have high blood pressure? I ain't gonna claim it. My family have, but I ain't gonna claim it. I ain't
Right.
claim no illness. I understand. Faith without works, though, is dead. And so it is what it is. Let's find a solution to stop it. I mean,
Absolutely.
the greatest military here in the United States, do you think they go to war without a plan? You got to know what you're fighting in order to fight. You know what I mean? So I think it's very important for us to understand that mental health is a key aspect to our total health and wellness, which
Absolutely.
is why we hired a mental health trauma therapist as part of part of our weight loss program.
And that's something that I prioritize in my
Yeah.
practice as well.
Yeah.
There's a lot of different kinds of nutritional therapy
Yeah.
utilized by registered dietitians. I don't really like to use the term nutritionist because it's not a real
It's not.
it's not a real profession. But for people working in nutrition, there are a lot of different ways to advise a patient, but my favorite form is cognitive behavioral therapy because it forces the patient to take a hard look at themselves, their relationship with food,
Yes.
how their outside factors have influenced their relationship with food, and to also remind them that in this body, in every body, they are still like a valuable human being because when especially when patients start to lose weight, they have family members and friends that say, "Oh my God, you're looking so good," or "Wow, you're looking amazing," and it breeds those thoughts that, "Well, what did you think of me previously?" And so it's important to remind those patients that you look good in every single body and that we want to change your relationship with food because that's what's sustainable.
Yeah.
That's what's sustainable in the long term.
Yeah. And I think you bring up another good point. When you go through this program, the way that you view yourself changes, the way that people view you changes. And sometimes those two pieces can take some time to catch up.
Yeah.
So, giving yourself grace through the process of losing weight, whether it's through GLP-1s or whatnot, but giving yourself the permission to grieve potentially every aspect of where you're growing and moving towards.
Yeah.
The person that you see in the mirror is probably not the person that we see in you anymore. Sometimes you can still have these same connotations of who you are in your head because of what you looked like 2 years ago, but you're not there anymore. And so, and then sometimes if we're not careful, we can become hyper vigilant and very hyper focused on our food,
Oh,
which
yeah.
can be a very addictive process. So I want you to remember that, choosing healthy foods is important. I want you to also acknowledge that it's not cultish. It's not like I need three blueberries, one this,
Right.
one that. It's the same thing every day because you're scared of going back. We need to create sustainable change that can happen long term. And that takes time. But if it's something that's not sustainable, if you're eating those three blueberries and it's something that's not sustainable long term, then that's not how we need to lose the weight.
Yeah.
We need to have a very healthy palate. Eat the colors of the rainbow. And again, if you need medication, you can get medication.
Yeah.
There's nothing wrong with that. So everybody's body is different. Utilizing the resources that are around you is important
Boom.
as well.
That's it. I use MyFitnessPal in the
Yes.
beginning of my consultations with patients. I'll have them for roughly 3 days, monitor or
Yeah.
input what their normal
Yeah.
what their normal intake is like: breakfast, lunch, dinner, snacks, fluids, just so that, because a patient will only tell you what they want you to know, like, oh yeah, I have a boiled egg for breakfast some days. And so it's like, realistically, for 3 days,
Yes.
just utilize this tool
Yes.
to see what your macronutrient intake really looks like. And I'll match that with my plate on, based on their BMI factors, what their intake should look like,
Mhm.
especially if they're expecting, or if they're looking to get pregnant, if they're breastfeeding, like that changes what your macronutrient intake should look like, and what your food group intake should look like. And once we understand what that looks like, I tell my patients, maybe utilize MyFitnessPal for one more week, so that you can get an idea of what your portion sizes on your plate should look like,
Yeah.
and then get away from it.
Yeah.
Because it becomes
Obsessive.
obsessive over time.
Yeah.
And you know what your portion sizes should look like after that. If you get to a point where you feel like you've lost it, then you know the resource is there, but
Right.
there's no need to use it as a crutch.
Yes, 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 yes. I think it's very important. Speak up. We want to be able to support you within community, which is why you guys are seeing this in our Lueur Collective. We want to make sure that we present to you community leaders and thought leaders so that you guys can continue to make the progress in losing the weight the healthy way that is sustainable. And if you're noticing there's certain things in your body that you need help with, we're introducing you to people that can help you in those particular areas. And so, again, semaglutide, tirzepatide, any GLP-1s or whatnot, they can be utilized as tools. But the idea is to get graduated. We want you to graduate from the program, but also have sustainable change. So, thank you, Dr. Cotton, for coming on
Thank you so
today
much
and
for having
talking
me.
to us. How can they get in contact with you?
So, our office is at 1801 Northampton Road, Suite 464 in DeSoto, Texas. You can also reach us on our website at isotochiropractic.com. All of our social media is at iSoto Chiropractic, and our business line is 469-454-8248. And we're looking forward to serving you.
All right, well, Laurette, so we'll talk to you later.
Woo!
Bye.